Chapter 22. The Heart and Circulation 1. Exercise 22.1. Complete the conversation based on the case history and be opposite. Doctor, what seems to be the problem? Patient, I've been getting palpitations. Doctor, how long have you had them? Patient, for about 6 months, but I've had heart problems for years, with tiredness and shortness of breath. In the end, I couldn't walk more than 100 meters without having to stop. I had to sleep on three pillows. I had a mitral valve replacement 3 years ago, and that improved things for a while. Exercise 22.2. Make word combinations using a word from Xbox. Two words can be used twice. Look at B and C opposite to help you. At rest, atrial fibrillation, cardiac output, heart failure, effort, uh, beating edema, premature beast. Exercise 22.3. Write the words a patient would use to describe two symptoms below. Look at A, B, and C opposite to help you. Number 1. Dyspnea, shortness of breath or breathlessness. Number 2. Arrhythmia, palpitations, and an irregular rhythm. Number 3. Orthopnea, breathless when lying flat. Number 4. Edema, swelling. 22.4. Complete the case report. Look at A, B, and C opposite to help you. Case 13. A 60 years old woman attended her GP surgery complaining of restlessness on effort. This had been increasing over the previous 8 months until it was producing problems at around 105 meters walking on the level. There was no history of chest pain. She had had several episodes of fast palpitation which last 20-30 minutes and were associated with some shortness of breath. She had noticed some wetting, sweating of her ankles by the end of the day. This disappeared overnight. Chapter 23. The Heart and Circulation 2. Exercise 23.1. Complete a table with words from A opposite, but address mark in front of the stressed syllable in each word. The first one has been done for you. Verb noun. Auscultate, auscultation. Examine, examination. Inspect, inspection. Palpate, palpation. Percuss, percussion. Exercise 23.2. Put the steps for examining the heart and circulation in order according to the four-stage system. Look at A opposite to help you. Letter A. Measure the heart size. Percussion. Letter B. Are there any murmurs? Auscultation. Letter C. Feel the radial pulse. Palpation. Letter D. Look at clothing inspection. Letter E. Locate the apex bit palpation. Letter F. Note any strills palpations. Exercise 23.3. Doctor is presenting the case of a 43 years old woman at a meeting in the cardiology department. Complete the text of her presentation. Look at B opposite to help you. On examination, she was parexial with a temperature of 38.5. She was short of breath. Her pulse was variable between 100 and 180 and was irregular in time and force. Her blood pressure was 130 um, 80 slash 80, and her GPB was of 5 centimeters, showing normal movement with respiration. Her peripheral pulse were all present, and there was not central or peripheral cyanosis. Her apex beat was displaced to the anterior axillary line, but still in the fifth intercostal space. Her he- her her heart sounds were very interesting. When she was initially examined, it was noted that she had pansystolic and diastolic murmurs, heartbeats, and the apex. When she was examined some hours later, there was a large pericardial friction rubs all over the pericardium. Our diagnosis at that time was for mitral stenosis and incompetence with a recent onset of pericarditis and atrial fibrillation. Thank you.